Good morning and welcome back to the Livingston Parish News Morning Show. My name is McHugh David, publisher and editor of the news. Appreciate you guys joining us this morning. If you're watching us live, thank you for that. If you are watching us later, we do upload these shows to www.livingstonparishnews.com/podcast. We do also have all of our coronavirus information online, www.livingstonparishnews.com/coronavirus. It's free. You do not have to pay for it, so you can go check things out there at your leisure whenever you feel like you have time to read. If you can't catch these shows first thing in the morning between 7:30 and 8 a.m. We're currently looking at some, the traffic is getting heavier. You know, we talked about it last week. It looks like more and more people are trying to go back to work. It looks quite the same this morning. You're looking at, it looks rather normal with your delays at 4-H Club Road, River Road, and 190 in Denham Springs. Also looking at delays at 190 and Range Avenue. You're looking at delays again at 190 and Jubin Road, and there's actually some minor delays at Range and the interstate. And however, the interstate still looks relatively clear. So once you get up on it, looks like you're going to be able to get right into Baton Rouge. But as of right now, you are looking at some surface street traffic here in the Denham Springs area as you're moving into Baton Rouge. No current delays on 64 heading into Central. With your weather, currently 59 degrees, 81 degrees is your high, 58 your overnight low. Had some thunderstorms last night, brought in some cooler weather that's going to warm up during the day and cool off during the night, at least for a couple of days. But you are looking at some sunshine, especially around the middle of the day. So keep that in mind, but not looking at any, doesn't look like any rain at this point today. But as we get into more of the spring season with the hot and the cold, might get some more, spot showers coming up. Talking about the coronavirus today, I want to remind folks that public officials over the weekend announced that the 19th of every month, so long as we battle the novel coronavirus, they would like for people roughly 7 p.m. On the 19th of every month, get out and celebrate the first responders, the doctors, the nurses, the patients, those who have died. Try to, celebrate their fight. So a lot of us who haven't had it or don't have to get it are thankful for their fight. Make anything from making a donation to a food bank, writing a letter to a doctor. I think even someone said, go out and just bang some pots and pans on your porch for a little bit. Just trying to celebrate these folks as they go to work every day to try to contain the spread of this and make it so that we can go back to life like it was, which is going to take some time, and we will talk about that in just a second. First, let's get some statistics out there. As of Sunday's numbers, 23,928 coronavirus cases in Louisiana, 1,296 deaths, 1,748 hospitalizations, on 349 ventilators. So remember, those last two statistics are really the big ones that had been driving the modeling early on, trying not to overwhelm public health care infrastructure. And so, the fact that those have been dropping is a big number, and we'll talk about that in a second. 141,000 tests have been performed in Louisiana. That right now, that's number one per capita. We kind of go back and forth with New York as who takes number one, but that's pretty impressive with a state with 4.7 million people trying to get the funding and getting those tests here to make use of them. Livingston Parish specifically, real quick, 426 tests, 148 total cases, and 8 deaths. So one of the things that the governor has been saying, especially over the last few days that he's been doing at press conferences, is that we're on the right track. We just have to keep those mitigation efforts, social distancing, and stay at home going until we are truly prepared to begin reopening some of the things that did close during the stay-at-home order. One of the things that we want to remind folks every day is about these mitigation efforts. Remember to wash your hands for 20 seconds or more with soap and water. Disinfect common surfaces at home and at work. Don't touch your face. Remember that one. Wear a mask per CDC guidelines. They ask that people wear a mask in public. 10 or less to a gathering, preferably less. Stay at home if you are sick and utilize telehealth to get in touch with your doctor, and work from home if at all possible. Those are probably going to remain after April 30th. There's a phased approach to it that might increase that 10-person to a gathering number. But for right now, April 30th to May 1st looks a lot like it does today, with some minor differences. And we'll talk about those minor differences in a second. Well, actually, we're talking about them now, because one of the things that Lobby, which is the Louisiana Association of Business and Industry, a large lobbying group out of Baton Rouge, said they got on the governor's side on this one and said that, reopening businesses must be responsible. There are essential businesses that continue to work that have provided a framework that many new businesses that are going to try to reopen should follow. A lot of this is going to depend on if we continue to have new cases drop. Now, what does that mean? That's part of the phased approach to this. One of the guidelines that was issued by the federal task force under President Donald Trump was that a state must experience 14 days of reduced new cases. So if you had, say you had 1,500 new COVID-19 cases on April 15th, by April 29th, every new day will have to have a smaller new case report for COVID-19. If you have a day, 2 days, 3 days where it goes back up, you're going to have to restart the clock. And that is according to Dr. Burks, who is on, Deborah Burks, who is on the federal task force, who kind of laid out the groundwork for that phased implementation. But as of right now, Louisiana is still on the right path for reopening the economy, starting on that May 1st date. The governor said that he has his own task force, which is going to be, he has a commission, which is going to be liaising with individual industries in Louisiana to see what the best way is to get them back on their feet. He believes that one of the first, and we'll probably hear more about this week, the first industry that's going to come back online is a full expansion back to regular operation of the healthcare system, which means clinics will reopen for elective procedures. After hours clinics will open to be able to serve those, who might get slightly sick at home, that sort of thing. Of course, you're going to be looking at a different kind of interaction, and we'll talk about that in just a second. There I am touching my face. Sorry about that. But the healthcare industry looks to be the first. What comes after that, we're not entirely sure. But that is the one that the governor has been discussing most at his press conferences. Now, what does the new normal sort of look like? One of the things the governor says is don't be surprised to go into work and see people in PPE. One of the things that Walmart announced over the weekend is that their workforce is all going to be required to wear masks. Up until this point, it had been a guideline and suggestion that those associates that interact with the public the most wear masks. Now they are going to require that all employees wear masks. I believe that begins today, April 20th. So please, that's one of the things that you're going to be seeing a lot of. You're going to get your temperature taken a lot more. You're probably going to see expanded testing. Actually, you're not probably going to see expanded testing. You are going to see expanded testing. That includes the basic COVID-19 test just to see if you have it. That includes serology testing, which they're currently working on now to try to see if you have antibodies in your system that are of use. But finally, and we explained this one over the weekend, there's going to be a lot more contact tracing. So what is contact tracing? That is kind of, I guess you can say, investigative healthcare. What they're going to be looking for, and this is Louisiana Department of Health, is when someone tests positive, they're going to be working in what's called concentric circles to find the people that surround that person that they've come into contact with over the past 2 weeks, as many as they can, and try to get those people tested. It's a very suppressive method of testing, very aggressive, trying to get to those people perhaps before they start showing symptoms or before they go back to work, trying to keep the infection rate down. Because one thing that the governor said is that they fully expect, this is the state government as well as the Louisiana Department of Health, fully expect there to be some kind of case spike as we go back to work, as the economy opens back up. The only way to kind of stay in front of that is rapid and aggressive testing. So that's something that's going to be going on after the economy begins to reopen. Hopefully, keep your fingers crossed, starting next week. So we'll see how that happens. Of course, we have to keep these mitigation efforts in mind. We have to keep practicing them. They will become part of life going forward, because the governor talked several times last week about what life looks like for a while. Even as you go through this phased approach, phase one is very similar to the way we're living now. This is the federal task forces phasing back in your economy. Phase two is larger gatherings as well. Is larger gatherings, and that includes schools and that kind of thing. Maybe up to 50. One of the things that the governor did say is that school next year may look very different than the normal school, the school that kids are normally used to. And phase three is basically life with PPE and masks until such time as a vaccine exists. There's a lot of large gatherings that we're used to in Louisiana. The governor said that, until we have a vaccine, you might want to get used to those looking differently. He didn't necessarily say they won't happen, but they might look differently than they have in the past. So a lot of that is conjecture. Right now, the governor and the state, and I know a lot of people sitting at home watching this are kind of focused on that April 30th, May 1st bridge, as healthcare begins to open back up and these industries try to get back to work in sort of this new normal, I guess you can call it. And not too late on that one. In Louisiana, 80,000 new unemployment claims came through last week, getting close to the 200,000 mark. Of course, that unemployment is $247 a week from the state, as well as $600 from the federal government. That was an enhanced part of the CARES Act. So you're looking at $847 a week. There have been problems in parts of the country where that amount is a little more than what most people would have earned, especially in places like Minnesota, California, Washington State. In Minnesota, actually, the state's unemployment combined with the COVID-19 enhancement actually puts you up into the $65,000 to $70,000 range. So there are going to have to be some I guess you can say restrictions moving forward as the economy opens back up. Government officials have said that they're not entirely sure what those look like just yet. They just wanted to help these families bridge a gap in the meantime, especially since industries were closed by government mandate. President Trump did also say that some states are going to start opening this week. He said parts of Texas have already started to try to reopen their economy, as well as places like Vermont. Places like us, however, he did describe as a hot spot. So we are going to have to deal with, I guess you can say, an extended period of trying to go through these phases. Again, those phases presented by the federal task force do not have a time attached to them. It's more benchmarks. So it really just depends, and the governor has said this before, it depends on how well the residents of Louisiana participate in the mitigation efforts, in the social distancing, wearing masks in public, trying to work from home if they can. And, if they do go to work, making sure that they wear masks, disinfect those common surfaces. I forgot one earlier, control your cough with your elbow and your sneezing. So, those are going to be important when work opens back up, to try to make sure that work stays open. There have been a lot of people on social media who have suggested that they're not going to change much about what they're doing come May 1st, knowing that there are a lot of people who are going to have to go back to work. So they're going to try to reduce that number by staying home. We'll see how that works. Of course, the state moving into sort of, I guess you can say, the state's grade in terms of social distancing. The state's grade in terms of social distancing has lowered again. It was a C-. It's now a D. And that is mostly because, as we've talked about earlier, I have anecdotal evidence as I watch a steady stream of traffic pass by my window. A lot of people are trying to go back to work already, and whether or not that was them wanting to go or bosses calling and saying you need to come back, I'm not real sure. I just know that based on the traffic report I give you guys every morning, more people are getting out on the road and going back to work. So we'll see if that has an effect several weeks from now, as remember, COVID-19 has a 14-day incubation period. the Council on Aging is kind of doing the best that they can to weather this storm. It's been a very difficult process for the meal sites throughout Livingston Parish as seniors call saying they just want to come back. They can't because those seniors are in that high risk demographic. Over 90% of the cases have affected people 50 and over in terms of deaths. And, the Council on Aging just cannot take that risk. On Monday and Wednesday, they spend time packing up shelf-stable lunches to bring to these seniors. And on Tuesdays and Thursdays, the staff makes calls to these individuals, trying to just have a wellness check, see how they're doing, try to get some kind of voice on the phone, get them talking to somebody, trying to keep that relationship open with these seniors as we navigate this very difficult time, especially for them and for those who were used to going up to the Council on Aging multiple days a week, trying to get, I guess you can say, some interaction with their friends. It's been difficult for them. So please keep them in your thoughts as the Council on Aging tries to keep that relationship open while we look for things to reopen in the new normal that's full of testing, PPE, and masks to come forth hopefully in the next few weeks. An Albany High graduate in 2019 who is now a freshman at Louisiana Tech has been utilizing a 3D printer to make ear guards for masks to try to reduce irritation, as a lot of these healthcare workers are having to wear masks all day. So you're looking at, so far she's made 1,200 and counting. She has 3 3D printers in her room that are working nonstop, printing out ear guards for these masks. So thank you to her for making those. We do appreciate it. I know those healthcare workers appreciate it as well. One last time, let's go over your mitigation efforts. Then we'll go over the cases. Remember to wash your hands for 20 seconds or more with soap and water. Disinfect common surfaces. Don't touch your face. Wear a mask in public per CDC guidelines. Control your cough and your sneezing with your elbow or a tissue. 10 or less to a gathering. Stay home if you are sick. Work from home if at all possible. Please remember, the state of Louisiana has 23,928 cases, 1,296 deaths, 1,748 hospitalizations with 349 ventilators currently in use. Livingston Parish has 426 tests with 148 cases and 8 deaths. 141,000 tests have been performed statewide, and that puts Louisiana at number 1 per capita in terms of testing. Please remember, with your traffic, you've got delays at 190 4H Club Road and River Road. You do have delays on Range Avenue at I-12. Right now, I-12 looking relatively clear, though, but traffic is heavier. Looking at delays at 190 and Range Avenue. You're also looking at delays at 190 and Juban Road. It's currently 59 degrees, 81 degrees, Let's start over. It's currently 59 degrees, 81 degrees is your high today, 58 degrees your overnight low. You're looking at a mixture of sun and clouds today. That sun's going to come out around lunchtime, according to current forecasts. And then it's going to warm up and then get cold again, or cool, chilly again overnight. One last time, my name is McHugh David, publisher and editor of the news. Appreciate you guys joining us for the Livingston Parish News Morning Show. Please remember, we are on Facebook, Twitter, LinkedIn, Instagram, and YouTube. We are once a week in print on Thursdays. That is $7 a month, delivered directly to your mailbox. Sometimes you get 5 Thursdays because we have a bonus Thursday that month. We are also online, www.livingstonparishnews.com. We do have a free section of that website, www.livingstonparishnews.com/coronavirus, which is free, where we're putting all the information we get on coronavirus and coronavirus related incidents as we move forward and barrel towards this April 30th, May 1st date. Appreciate you guys joining us this morning. Hope you have a great day. Hope the sun comes out and you get some sunshine, and we will see you tomorrow morning.